Good afternoon, everyone, and welcome to today's webinar, Staying Secure, Why It Matters for the Maternal Health Space. My name is Julia Slanina. I'm the CEO of Treehouse Medical. And thank you again for joining us on a discussion today about security, privacy, and compliance in Canada and the maternal health industry. You can change the slide. My name is Julia Slanina, as I mentioned. I'm the founder and CEO of Treehouse Medical, and joining me today, we have Aidan Gilmore, our Chief Technology Officer. Treehouse Medical is Canada's first maternal healthcare management platform for doulas, lactation consultants, and midwives. The only two-way platform where providers can securely communicate with their care team and their clients, along with managing their care journey. Learn more about Treehouse today by joining us on our website, treehousemedical.ca, or following us on social media, and see how we can really help you through the maternal health journey and beyond. We are so proud to power today's event and have Balaji Gopalan from MedStack to help us learn more about what it means to be compliant. Please feel free to engage with us via the chat throughout the discussion, and we will be happy to moderate the discussion during our Q&A and at the end of the talk. MedStack is an out-of-the-box HIPAA-compliant solution for digital health startups. They empower innovators to easily build compliant applications from start and meet the requirements of today's healthcare enterprise systems. Joining us for discussion today is Balaji Gopalan. He leads business development and strategy as the co-founder and CEO at MedStack. As an expert in product management and software platform ecosystem design, Balaji is also a well-respected startup educator, advisor, and mentor. He is an advocate for the role of ecosystems in industry transformation and in tackling tough problems like improving healthcare. So before we jump in on the content, let's move to the next slide where we talk about the agenda for today. We're going to brief you on a scenario of a potential breach. We're going to talk about what is protected health information and why it matters. How is protection enforced in Canada using HIPAA and PIPEDA? We'll dive a little bit deeper into Treehouse Medical's security infrastructure, and we'll close off today's discussion with some key takeaways as well as our Q&A. So with that, I'll turn it over to Aidan Gilmore.
Okay, so we're going to talk about one possible scenario of a data breach. Now, there are many possible ways that information can be exfiltrated from medical organizations. We're going to go through one of the most dramatic recent events where data was leaked. So everything I'm about to tell you is a true thing that actually happened in 2019 in the United Kingdom. We will not be naming the company for obvious reasons. So let's begin. So the year was 2019. A grand time for the fledgling telemedicine industry. All was going well, but then tragedy. Tom was a patient for Company X and used it through his insurance provider. He went to go in to get information on a prescription, but he was in for a horrific surprise. He noticed that he had access to videos of 50 consultations that did not belong to him. The press managed to get news of this event, and it forever tarnished the name of Company X. Now, this to me is indicative of a larger problem about their general mentality for data security, how they're architecting their application, how they don't have proper access control measures to make sure that people can't get access to this type of information. And we're going to go into how we architected our application a bit later to prevent these type of breaches. Now I'll hand it over to Balaji.
Thanks very much, Aidan and Julia. Hello, everybody. I'm incredibly honored to be participating in this very important session, both as an advocate for data privacy, as an advocate for digital health. As a parent, both my children were born with the expert care of midwives. So this is really, really close to my heart. This is a very complicated space. And the very compelling story that Aidan just ran over happens, unfortunately, far too often. But if we're going to be continuing to earn the trust of the people that we work with, both in terms of the expert care that we provide to them and the care for their data, which is just as important, then we need to think about these things really carefully. And the first thing to understand is, what kind of information are we talking about? And I want to kind of overview this in a couple of ways. The first is really the reason for protection is to think about health data as the most sensitive data in the world. A proxy for this information is on the black market in the United States, for example. Information about somebody's health is actually worth, from a monetary perspective, over 30 times that of what a credit card is. And this is because if people can get your health information, they can actually be you in one context when you talk about sort of health insurance and other things that matter. But if we kind of tease this out, then we're really thinking about all of the ways that an individual interacts with somebody in the healthcare ecosystem. And I think this area that the Treehouse very wisely is looking at is definitely included in this arena. So this includes things that we naturally think of as healthcare, such as biomedical information and health information, but also all of the ways you interact with the healthcare system, who you are, where you live, what appointments you have, what prescriptions you have, what conditions you have, what decisions you make in the healthcare industry. All of these are actually included in the list of protected health information. So the first thing to think about is the fact that it's very sensitive. But the other thing to think about, and if you talk to somebody in the cybersecurity world, they'll kind of tell you this, is danger when it comes to not protecting data doesn't just come from that data itself being exposed, but also consider that hackers are often in the business of aggregating multiple data elements together. So if they have something that might be seen as innocuous about a person, they might have other information that putting the two of them together, which often happens, can lead to a situation of some risk. Next slide. And so the thing to think about actually is this notion of privacy actually goes really far back. And it's integrally tied to the overall healthcare industry in all its aspects, and has been from the beginning, because we've always known that health data is the most personal data that's out there. On one hand, if people know about your health, then you can become the target of, even the most simple thing is you can become the target of advertising that you didn't want or expect. And certainly the notion of the birth of a child is a very, very personal experience that people should own and shouldn't be commercialized. But that's not even the thing we're most worried about. We're worried about that information getting to people that it shouldn't get to, and then those people deducing that information to determine and make decisions about you that you can't control. The quote you see on the screen actually dates back to the rewriting of the Hippocratic Oath back in the 1960s. Even back then, the doctors who signed up to their medical profession in any field of medicine had to make a commitment that said they not only will do no harm to their patients, but that also means do no harm to the data of that patient. And this is, of course, the ages before the modern computing industry they know of. So HIPAA and its equivalents up here in Canada and in Europe and in the rest of the world is actually not written specifically for digital, but it's written for data in general, even if that data is on paper. We have a commitment to track who has access to the data, when did they access it, how did they access it, how were they given access, how are they revoked access, how the data protected, and what do you do if there's a breach? Whether you're talking about a hospital, a clinic, an insurance company, a laboratory, or other aspects of healthcare. So the thing to think about next is how the law looks at these types of breaches and security expectations. And, I'm happy to sort of explain the way this works, but the thing I want people to think about is we have a responsibility not only to adhere to what the regulations expect of us, but we also have a responsibility to adhere to what the public expects of us. And we all know we're now living in a world where public expectations around data privacy are at a level we've never seen before. Whether you're talking about things that are not healthcare specific, such as issues with social media, for example, financial services, or healthcare specific things like, for example, the breach that happened with the laboratory testing company a few years ago, or last year here in Canada. So I'm going to go through some terminology here, and the purpose of this is to arm this audience, whether you're a provider or you're somebody who's taking advantage of the services of a provider, or somebody who works with both of them therein, to understand the context in which you're working in. So in Canada, we actually have a somewhat unique and uniquely complicated approach to data privacy from the healthcare perspective, because the country is governed by a general data privacy law, which is called HIPAA. I won't attempt to remember what all the state words in the acronym stand for, but it's personal information in electronic documents, really. So this is always talking about information pertaining to person and how that's managed. And there are callouts from HIPAA that govern enterprises and organizations in the way that they manage manage data in general, and they're actually specific healthcare data callouts as well. But further, because our delivery of our healthcare system is actually governed provincially, and this is actually pretty unique in the world, each province has its own laws which talk about how healthcare services can be delivered, but it also has within those laws expectations around data privacy and security. The good news is the fact that they're all different it provides some complexity, but some of the things that they're asking for from the perspective of how electronic data is managed and how electronic data is protected largely kind of align. So in Ontario, we have this thing called PHIPAA. In British Columbia, there's this thing called FIPA. Generally, they kind of ask for the same things. Not to get too technical, but one question we see a lot is, does the data, if it's electronic, have to be hosted in Canada? You might be wondering why that is even a question. The reason that's a question is because privacy laws in different parts of the world give different levels of access to the government and other organizations for investigations. And in the US, of course, after the events in September of 2001, some of these laws were changed that allowed the government access to certain information. And so the Canadian healthcare industry in general, and legislatively in certain provinces, mandates the data has to be hosted in Canada, so it can't be exposed to that level of investigation. Some of the provinces don't expect it, but I will tell you the industry in general expects it across the board. And this not only applies to doctors in people with medical degrees, but really anybody in healthcare. And so I applaud the work the College of Midwives of Ontario has done in calling out how this industry has to think about PHIPAA in Ontario and the ways in which it adheres. And what I would say is it really comes down to the same questions. What are you doing to treat with respect the data around the patients that you see? How are you protecting that data? How are you being careful about who can see it and who can't see it? And how are you keeping that data under lock and key and assuring that people who have those keys are authorized to have those keys, whether the key is a digital key or something that sits on a keychain. So we're going to talk really quickly about the U.S. and there may be attendees in this session that are from the United States, but I think even if you're not, it's really important to understand what HIPAA is. In fact, you'll actually hear people in Canada talk about HIPAA compliance, which is kind of a colloquial thing because HIPAA is actually an American law. It doesn't technically govern us. However, the reason everybody talks about it is because it is generally considered to be the most well-written, stringent, and highly respected data privacy law in healthcare around the world. Kind of interesting because in general, the US doesn't always lead the rest of the world when it comes to data privacy, but in healthcare, it does. And the reason it does, just so you know, is actually their private health insurance industry. So if data privacy isn't governed and managed properly in the healthcare realm in the US, the private health insurance industry, and there's a lot of money in that space, is put at risk. So they're the ones that actually created it. Now, what's a few interesting things about HIPAA? And again, the reason we talk about it is because when you peel the layers back and look at the expectations, even though in Canada we aren't governed by HIPAA, really the kinds of things PIPEDA and the provincial privacy laws are asking for map to HIPAA pretty closely. And I can say this because that's actually how we built our company. We built MedStack by looking at HIPAA first, and then came back to Canada and looked at the laws here and realized that all of our protection policies actually applied pretty nicely, with the exception, of course, around where the data is hosted. HIPAA was created before Google was. So you can actually understand when people ask the question about how do we apply HIPAA in a digital context when it wasn't written for a digital world, is a very relevant question. In fact, there's tons of articles and theses out there around how digital companies should apply to HIPAA, and that complexity is the reason why we exist and why we're so happy to be working with Treehouse to make this something that's reliable and repeatable. So it was created by the health insurance industry, but importantly, it really didn't come into proper enforcement until the latter part of the first decade of this century, when it was amended with this act called the HITAC Act, which most importantly gave access to the state governors for the enforcement of HIPAA. And now we're in a place where the fines for HIPAA violations continue to go up every single year because more and more people, all the way from security investigators, legislators, hospital CIOs, down to patients themselves, are laying claims, rightfully so, to the violations around data privacy. So as I said earlier, when you think about compliance and you map it to digital data, which is really relevant in this context when we're doing so much more virtually and so much more digitally in all aspects of healthcare, come down to these questions. And these we drew these out by actually reading acts like PHIPAA and HIPAA and kind of asking, what are they really being asked for? But this has also been informed by the typical questions that are asked by the heads of privacy and security in major healthcare institutions, whether you're talking about hospitals or insurance companies or others, around how they can work with a digital product, such as the one that Treehouse is building. So they're going to want to understand where the level of the relationship is. So you might hear this terminology, especially in the US, of a covered entity and a business associate. The covered entity is the one that has the relationship directly with the patient, the providers. So for example, some of you may be covered entities if you're working in the United States, and the business associates will be people that you work with that have access to that data, such as a digital application provider. And the questions being asked will be all around, where does the data come from? What did you do to protect it physically and digitally? Where can the data be accessed? Who's using it? When did they get access to it? And what do you do if there's a breach? So if we understand what the expectations are, it still doesn't really give us a lot of clarity on what to do to achieve them. And perhaps one of the most frustrating things that people think about is, well, what am I allowed to use and what am I not allowed to use? Because security is one of those things that people can say exists, but you really need to peel the onion in terms of understanding what they mean when they say things are secure. And so, we've run into a really interesting situation, for example, recently, where just as the world moved to suddenly requiring more and more interaction digitally, whereas before things were done in person, because of the quarantine and the pandemic, at the same time, what could have potentially been the biggest and most important digital engagement tool out there, especially in the business world, but really in all spaces, Zoom was hit with a major controversy in privacy and security. Whereas up until that point, they made claims to the level of security and encryption and protection they have, but it was revealed that at the back end, some of those statements weren't quite true, and the data was being exposed to perhaps some nefarious sources within organizations such as the Chinese government. Now, to Zoom's credit, they've actually made a bunch of improvements since then. Me personally, myself and my company, we tend to be a little bit cautious and skeptical, because it's one thing to have an error in compliance and security. It's another thing to have an error in compliance and security and lie about it, which is kind of the situation they were in. So we're asking for things like, who's got a third-party security and privacy assessment done? Who has SOC 2 compliance, which is a certification that's offered by a security professional independent of your company onto the tools that you're actually using? And what we're actually determining is there's a lot of things people take at face value that may not actually be treating privacy and security in the right way that it needs to be treated, especially when you're talking about such such sensitive data. And so, it doesn't take long to look at Zoom and FaceTime and WhatsApp and to find out that there are kind of holes in some of the things that they're all being said. WhatsApp very famously has what they call end-to-end encryption, which means that the data is encrypted from one end to the other. But at the same time, last year, it was revealed that it's very obvious for somebody to receive a message that ends up becoming a phishing attack on their phone that can then expose the chats to people that don't need to see them. And considering WhatsApp is a consumer company owned by Facebook, I would say that this is something that we have to continue to be looking at. But the other question is, do people care? Fair question. I'm a privacy geek, so I'm going to be talking about this stuff. But do people in general care? And I think the answer is yes, because if we look at the public concern around Zoom, if we look at the exodus from Facebook, we look at the concern that was raised around Equifax and Life Labs and Target, people are increasingly concerned with the way that their privacy and security is being managed. And certainly when you're talking about something as personal as the birth of a child, this stuff becomes really, really important. And to sort of say then that you don't need to be compliant, again, this isn't about the law and its governance around you, although that's very important. This is about the responsibility you have to keep your patients and their data safe.
Okay, so now we're going to talk a bit about how we are addressing the issue of security specifically. Now, security, in my view, is a bit like an onion in that you want multiple layers of security. So one system is able to fail gracefully, and you will still have the data integrity being preserved. So what we do is we have end-to-end encryption, which Balaji mentioned. We do it much like WhatsApp, but we're honest about it, and we have it from front to back. Sorry, my phone. Anyway, so what that means is that when you encrypt something, you generate a key, and that key is like a diagram on how to scramble the information. And with end-to-end encryption, only you have that key. So we can't read the documents. Only you can. Now that means that when you're communicating between a doctor, our servers, everyone else, we can't look in on it. And that helps keep you safe with mathematical integrity. So there's no way anyone's looking at it anytime soon. Additionally, when the documents are stored on your device, we encrypt them as well with the device's key, just to give an additional layer of security on top of that. So that means if someone steals your device or whatnot, they can't read the documents. On top of that, we use something called application sandboxing, which means that the application that runs on your system is isolated from the rest of the system, meaning that if there's any issues with, for example, a virus or something running on your system, we can help protect against that by running it inside its own little isolated box that'll keep it safe. Now, additionally, sometimes we will have security flaws. Everyone does. We're very proactive in addressing them, as having end-to-end encryption proves. But because of that, we're going to have automatic updating that will keep your system secure and with the latest patches, all without people noticing. So we're able to keep things going. Now, next up, we're using MedStack on the servers. And that provides a ton of security just out of the box. So that means that everything stored on the disk is encrypted as well. So if you pop the disk out of the disk tray from the servers, you can't read what's on it. And that's very important because even though all your data is end-to-end encrypted, there's something called metadata. And that's how the data is used and accessed. And with that data, we can get information about you. And we try and limit as much of that as possible, so we don't collect much at all, very little. But anything we do collect is encrypted on the disk. So that helps provide an additional layer of protection. Additionally, they have firewalls to prevent attacks, an intrusion detection system to see if someone is poking at it and managed to get in. They make sure that everything between the server and the client is encrypted securely. And they keep the system up to date with up-to-date patches. Finally, we have the data center level security. Now, software security is very important, but it can only get you so far, because if someone has physical access to the hardware, they can do things to it to manipulate it, and that can affect whether or not the data can be exfiltrated. Now, we're using Microsoft Azure, which is a platform provider that MedStack provides. And their servers are put in very secure data centers. The data centers themselves have a tall fence perimeter with 24-hour video surveillance and a full-time team of security monitoring them. The entrance itself is staffed with well-trained security personnel with rigorous background checks. And to move around the data center, you need both an ID card and a form of biometric authentication, which means either fingerprint or iris scan, something that's physically authenticating that you are who you say you are. Now, to get into the data center, you need to pass a full body metal scan. And there are video cameras on the front and back of every server rack, which is the towers of servers, to make sure no one's adding things and messing with them. And when you leave the data center, you have to go through a metal detector again. And that's how we can make sure that you're not stealing hard drives or anything like that. Now, when hard drives and other systems are decommissioned, they're securely destroyed in ways that meet US government standards and healthcare standards as well.
Thank you, Aidan. And thank you, Balaji, as well, for a very thorough discussion on really the various elements and educating all the individuals who are listening today. I think before we jump into our Q&A, I think it's important for us to, we could have really a discussion about the key takeaways, but we really kind of just made it into 4 really main key takeaways. And the first one is the fact that we are really reimagining maternal health during COVID-19 and beyond. This is an opportunity where this industry and this area has never really seen this type of uptake in digital response as we have seen in the last 5 months or so. So it is really critical that we have this discussion about privacy, security, and data protection as not only a way to protect your clients and the patients that you see on a daily basis, but the way that you now are operating as a business yourself. Because although that you provide health care information and absolute care, and you follow your clients through a care management kind of journey, you yourself are also trying to scale your business, but also ensure that you are compliant at the highest levels. So that is a really critical element in understanding how you're going to move forward, not only during the pandemic, but even beyond the pandemic. Mainly because this entire industry has been, quite frankly, disrupted to the point that now the way that maternal health will be conducted, whether you are in an urban setting or in a remote setting, will have to consider these elements of the highest level of thresholds, specifically around security and privacy. Again, we reiterated today about protected health information and how that is not just the traditional medical information that we maybe think that doctors use in a clinical setting. And the last key takeaway for today's discussion is that digital and virtual health is really the future for maternal health industry and globally. And so we are actively here to discuss ways by which you should consider as a provider, but also ways if you are an individual who is receiving services, should think about how your care is managed and how your care is actually maintained and what is protected. So if Aidan or Balaji would like to jump in on any of these key takeaways, I welcome any of your comments.
Yeah, I mean, I think from my perspective, it's really important to know that the effort and notion in protecting information and using tools that inherently protect information and can be proven to show that they do is an important aspect to just providing good care. It drives trust between the provider and the patient.
Yeah.
It drives additional innovation. It drives better access to data in a secure and authorized manner, which in turn provides better care.
Right.
And so, I guess I would like to, first of all, thank and applaud the attendees of this call for realizing that that's important and thinking about ways that they can actually make that part of their practice in ways that don't interrupt or have to get in the way of the quality of the interaction between the provider and the patient itself. It is not a zero-sum game, and I think that's a really important thing for people to think about.
I agree. That's a really good point. Absolutely.
In general, people have always had to put up with a trade-off between security and convenience.
Right.
And as time has progressed, we have found ways to make security a lot more seamless than it once was. Back in the day, you'd have to go around with paper keys and trade them at like key signing parties and things like that. That's no longer the case. You're able to have very effective security without even noticing it nowadays, if you're using carefully designed applications that take all of that into account.
Great. So with that, I think maybe we'll get the Q&A started. This presentation doesn't need to extend to the full 60 minutes, and sometimes we wrap it up a little bit earlier, mainly because the Q&A and what we've discussed already has already been covered. But regardless, we are here to answer any questions. So we welcome any discussion questions. Feel free to put them in the box on the right-hand side of the YouTube live stream, and we'd be happy to answer them. But in any case, to just jump in the Q&A. One of the questions that we see a lot from providers, specifically in the maternal health space, is, well, I'm using other platforms. I'm using other platforms at the moment. And Balaji kind of alluded to this earlier in his discussion. But individuals say they use other platforms and they advertise they're HIPAA compliant. They advertise they're end-to-end encrypted. But what is it that I should be looking for that really takes it to the next level?
Yeah, it's a great question, Julia, and I appreciate that it's a complicated one. What we're not trying to do is ask everybody to become a cybersecurity or IT security expert.
Yeah.
But there's a difference between tools that are designed for healthcare and its unique expectations around privacy and security, and tools that are not. In general, we found that is a bit of a split. And so, if something is described as being encrypted, I think it's important to understand, what does that actually mean? And is encryption itself enough? Because encryption just simply means that you've got keys kind of at opposite ends of the spectrum in the path of communication, and the data within it has a layer of protection. But what statements are they making with respect to when the data is at rest, who's got access to it, and how are they tracking that access, and what commitments can they actually make? What I would say is the safest way to know that you're using a tool built for healthcare is to use the tool built for healthcare. Because the requirements, the simplest way to think about it is that building security is not simple. And it's not cheap either. And when you have a product that's targeting a mass audience, of which some small part of it is healthcare, they're going to err on the side of how can they deliver the service to the largest number of people. And, again, it's simply a business decision. I'm not detracting against any of these providers or what they do. Many of those tools I use myself, but I don't use them in the healthcare context because I understand that's the difference. So, we should be looking for advocacy from people in this industry for the different tools that are being used.
Mm-hmm.
And you'll find tools built for healthcare are better for healthcare tasks as well.
Absolutely.
using, for example, okay, I'm just going to plug ourselves here because I think we're pretty great. But if you're using our platform, you'll find we have intuitive understanding of medical scheduling and things like that that other platforms just don't. So there's additional features that you will get a benefit from on top of the security.
Right. Absolutely. There are so many other kind of elements to it that it's just not only about the privacy, but the understanding behind the industry, the needs of the industry, what are the challenges that they're facing currently, and what we could predict for the future. A lot of our providers, some of them are sole practitioners, so they don't work out of a clinic. And so they say to themselves, well, I don't need that many clients, birth clients, in a month, just in comparison to others that have multiple providers in a clinic or agency setting. So I keep notes on my client, and that's just me just jotting some information down. Is that information protected health information? I'll let you address that.
It absolutely is. Again, going back to what I said originally, HIPAA was written in 1996 before Google existed. It was not, if you look at the way the law is written, it doesn't say anything about software, programs, disks, bits and bytes. It actually was written to govern paper records in a filing cabinet, whether that's in a large clinic or a sole clinic. Some of it's cultural to a degree, but like, for example, when we as a company find ourselves working with an application provider who might be even working with a sole practitioner in a single office, especially in the US, they are as concerned about HIPAA as a big hospital is. And in actual fact, I had somebody tell me, just if I can offer this story as a bit of an illustration.
Please. Yeah.
From another application provider in a different medical space, who was working with our platform, who just as easily were selling to a large department in a hospital as they were selling to an office with 2 or 3 practitioners in it. And they said, in cases where we're being asked what we're doing, it's actually the same level of diligence. And because if you go back and look at the law doesn't say this applies to you only if you work in a clinic of a large number of people. If you are touching any of this information, the law expects you to be following it, and I think the industry and your community will be expecting you to follow it as well. Whether that's digital data or that's paper data sitting in a notepad. And I would go further. I agree there's some bias here because I'm a digital advocate, but I'd go further to say digital data can actually be protected better because we can audit electronically who's got access to the data, when and how. And this is why encryption itself is not enough for compliance. You actually need an audit log, which is a system that tracks who got access to the data, when they access it, how did they access it. And if you have a piece of paper sitting around, there's a chance that information can get to the wrong person. You wouldn't write down your password and stick it on your computer. So you should be careful about writing down information about somebody's birth plan and putting that on a piece of paper as well.
That's right. Great point.
It should be added that a audit log can be done cryptographically as well. It's just very difficult to do. And that's why you need specialization in this field. The other thing to know about these laws is they're non-prescriptive. So they don't tell you what steps you need to take. They just tell you you need to do this. And that makes it much harder additionally because there's no real check boxes. There's just outcomes that need to be attained.
And that could lead to a number of other individuals or other companies that could essentially make those claims that they are compliant to certain levels. But again, because it's non-prescriptive, it can be twisted however and advertised however to serve whatever the need of the customer is. I guess we kind of touched on this question, but I'll bring it back a little bit, maybe just to kind of reiterate the point. Jurisdiction is is a question that comes up sometimes, because oftentimes providers feel that, oh well, I'm in an urban setting. Maybe I'm in a province like Ontario or British Columbia or Alberta, where maybe discussion about compliance comes a little bit more to prominence. But then there are other areas that sometimes feel a little bit more gray. How does jurisdiction play into ensuring that you are compliant nationwide?
That's a great question. Jurisdiction is one of the most complicated things to think about when you're looking at digital products, because the internet doesn't have borders. It's global. And so I dealt with this actually in a previous iteration of my career, even before I got into healthcare, around these questions around how do laws apply when data is moving. And the internet itself was complicated. Now we've got mobile internet. So where the internet endpoint is actually depends on, is your phone in your pocket when you walk from one place to another. But just to kind of illustrate how tricky this can be, probably the most complicated thing that's happened from the perspective of privacy, compliance, and jurisdiction was the introduction of GDPR. And so for those who don't know what GDPR is, GDPR was a new law that was introduced in Europe, which itself is a complicated thing because it was happening at the same time that the UK was leaving the European Union. And it's generally seen as the gold standard for privacy laws. Preview, the Ontario privacy laws are likely being rewritten to map to GDPR. California has already done this with the California Consumer Data Protection Act. The really crazy and tricky thing about GDPR is that it doesn't apply to where the provider physically is. It applies to where the patient is from. So if you are a midwife servicing somebody who has dual citizenship between Canada and Italy, they have a right to be governed by GDPR, even if they're sitting in Windsor, Ontario. And what GDPR says is all of the expectations in data privacy. Lucky for us, those of us who operate in healthcare are closer to GDPR compliance than those who may not. GDPR applies to everything, not just healthcare. But it even has provisions for saying things like, if that patient calls you up and says, please delete all my data, you have to do it. And this is extremely complicated. But really important. Those of us who are privacy advocates are very, very happy with GDPR. It puts the data control in the hands of the individual. And it's so controversial, in fact, that Google has been in the courts in Europe over their approach to GDPR, because this is a really, really tricky thing. All of that aside, generally speaking, the laws have a jurisdiction which will be either geographic or citizenship based, and says that if you're operating in this environment, you need to follow these laws. If you're operating with this person from this geography, you need to follow these types of regulations as well. And that doesn't matter whether the place you're in is an urban center or a rural center. The expectation is still the same because it's still following the same rules. I mean, the best analogy one can always use when you're talking about these kinds of things is seatbelts. You don't have a lax on seatbelt laws in a small town as you do in a big urban center. The expectation is still the same.
I like that analogy a lot. Great. It puts really a lot of visual into everyone's mind, right? Aidan, do you have anything to add on that?
No, that was very comprehensive.
Yeah. Well, with that, I don't see any more questions trickling in. So I think unless we have any other points that we'd like to just reiterate, I'd like to just offer a bit of my concluding remarks then. So my sincere thanks to everyone who took part in today's discussion. We are thrilled to really have had this opportunity to connect with the community and, of course, with MedStack. We would be happy, of course, to answer any further questions offline or receive any feedback from today's talk. We offer you the ability to also connect with MedStack as well. If you do have any questions directly related to how they operate or how they can even support your particular questions that you may have. We wish everybody well. We wish you to stay healthy and happy and keep positive. We hope to see you again soon as we look to continue to expand our virtual content series. And we look to talk to you again. Thank you very much to Balaji and to MedStack. And thank you to everyone again for being here today.
Thanks very much, everybody.